Solis, the Los Angeles County Department of Public Health, and the many organizations and local advocates who have stepped up with great leadership to respond to community needs that have been neglected for too long. The results show what we've known for too long, which is that the level of services have been lacking. These communities should not feel fear or uncertainty about their family's well-being, but should feel confident that they are supported and valued. The state has a legal and moral imperative to expedite the testing of homes, and it is also imperative that they effectively communicate with residents about the current environmental conditions, potential health risks, and the actions needed to protect their health. Outreach efforts are needed to make sure that all residents in the neighborhood surrounding the Exide facility have support securing access to affordable health care and social services. Local health providers need to be informed about the community health risks in order to effectively address concerns and direct patients to appropriate screenings. Young children living in these communities need increased support and services since they are at the greatest health risk from the contamination. The county, along with community organizations, healthcare providers, and schools, should continue to work together to increase participation in blood level screenings and offer enhanced services to children and families who have been exposed to these hazardous, poisonous chemicals over an extended period of time. The DTSC should provide soil test results without delay and in a manner that residents can understand. It should also work quickly to implement a comprehensive community cleanup plan that is supported by the community and begin removal of the contaminated soil immediately.
Thank you so much, Gladys and Andrea, for participating and really working so hard in this community for justice. We are deeply indebted to all of the work you and your organizations have been doing. And now it gives me great pleasure to introduce a real champion of social justice for these communities and for the entire county. As many of you know, Supervisor Solis has been working hard over the years to make sure that issues around promoting and ensuring the well-being of people who live in communities that are often marginalized are addressed and are addressed quickly. But I just found out from Jane that Supervisor Solis also was responsible for the first piece of environmental justice legislation for the state of California. So we owe Supervisor Solis a huge debt of gratitude for recognizing early on how important it is to address issues around environmental hazards that are disproportionately released in communities of color and in poor communities. So thank you, Supervisor Solis, for your wonderful leadership.
Thank you so much, and buenos dias. It's a pleasure to be here, and I also want to thank Dr. Barbara Ferrer, the County Department of Public Health, and all of the individuals here that are gathered, in particular the residents and people that have been impacted by the egregious operation of the Exide battery recycling plant. Thank God it's closed, but the damage is still here. And I'm very, very glad that for the first time in the history of the County of Los Angeles, we had 1,500 people converge on a Saturday, almost a month ago, to go out and knock on doors and to talk to people in a manner that is respectful of them, to get their input about what Exide has done to their families and to their neighborhoods and what they know about exposure to lead. And many people, as it comes back to us, were telling us that they were not fully aware of the impact that lead would have on their bodies, on their children and their families. They are scared. They're wondering what effect, who's going to be impacted by cancer. They're equally concerned that they don't have adequate access to information about how to go through the process of finding out if they've been contaminated by lead or arsenic or any other contaminants that may have impacted their households and their children. So we have a lot of work to do. And what I would say to you is that we're just starting again on this process. I am going to ask the Department of Public Health and our health agency to help provide a mobile unit out here so that just as we did on that Saturday, went door to door and we broke it up block by block, is to go back to individuals to tell them what the input and results are from the survey, but invite them also to get signed up, to get that blood test done for their children or for themselves, but more importantly, learn about other healthcare prevention services that the county can offer to them. We can't wait for the Department of Toxic and Substance Control to get out here. It is too long and too late for some of these people that we met. Some have already had family members pass away from cancer, tumors, and a life that's been shortened. We have small children that still live in these communities under the age of 6, and I don't think I need to remind people what the exposure is of heavy levels of lead and that exposure to these children and their developmental disabilities that we've yet to fully uncover. We have an ominous job ahead of us, and I am very, very happy that we have the county, public health, the health agency, and all of the stakeholders here working with us side by side to help provide the kind of support that we're going to need, because our work still is not done in Sacramento. There is money that this community fought for that's waiting to be spent to continue to clean up these houses, and that is our immediate concern. To have those that are most impacted, the families and the households, is to begin that cleanup process as soon as possible. And the more heat that we put on the state, the better off we're going to be. And I hope all of you here will stand with us to make sure that that happens. Enough. Ya no tenemos paciencia. La comunidad ya no puede aguantar lo que está pasando ya casi tres décadas. Muchas familias todavía tienen miedo, piensan que no saben qué va a hacer con sus cuerpos, con sus niños, especialmente muchas mujeres que hablaban con nosotros no sabían los resultados de los exámenes de sus casas. What an embarrassment. The DTSC goes out and